We are an amazing organization. Everything that we do is for the community and how, important they are to us, and we're just as important to them in making sure that everyone is in their right body and mind and spirit.
I think Neighborcare does things a little differently, that we're a community partner, and so we're in the community, in the school, and we see kids every single day, and we know the context of their life.
Having the resources to help people overcome any barrier that they have to healthcare is really important, because that's going to affect everybody.
I don't think that a person's inherent value or dignity should depend on their zip code, how much money they make. I do believe that everybody deserves the same access to healthcare, the same opportunities to live an enjoyable, healthy life, and that's why I do this job.
We're here not for profit, but for care. If we wanted to be for profit, we would work for profit. Every child, no matter their background, no matter where they're coming from, financially gets to be seen. And the mission is to have access to healthcare that is not always accessible. I mean, not only for the school-based program, you have a mental health therapist, you have your nurse, and you have dental all in the same place. What other resource do you have like that? You can't even go to a hospital and have all those resources in one space.
So the best part of my job is coming in and seeing the kids. They are just so funny. They will just come up to me and say the strangest things, and it's been very meaningful for me just to see how the kids come in, and they're pretty reserved and pretty closed off, and then over time you just build this trust, and you're kind of a reliable person in their life.
We also have students who it's their first time, and I love making them feel comfortable in the dental chair. We also have students who need you to hold their hand, and that's also my favorite part of the day.
The best part of this job as an FNP is definitely seeing progress. Being able to be a part of patients moving forward towards their own health goals.
One thing to know about me is that my friends and family do come to Neighborcare. I have seen them when I'm at other clinics. And that's what I would tell people who's never been in Neighborcare. You're not going to get a provider that's going to force anything on you. They're going to talk you through it. They're going to make sure that this is a nice experience. They're going to want you to come back for your follow-up visit, so they really are interested in you, the person.
Growing up, I also went to Neighborcare. At the time it was PISNIC, and then in 2015 I worked for an organization, and it unfortunately had dissolved, and so at that point in time I did not have healthcare coverage, and I had a dental procedure that I needed to have done, and immediately once I had gotten state care, I reached out to Neighborcare and was able to get my dental problem taken care of immediately and comfortably.
My grandparents immigrated to the US from China, and my grandfather, he had numerous barriers to accessing healthcare later in life. And so all of those experiences together have helped inform my understanding of what each person comes into our clinic with.
For my personal journey, it took several doctors in different areas of healthcare to figure out the best ways to support my body. And that's been really hard, and it's so much work. And so when we have patients that come in here and have a chronic condition that needs so much work, I really feel their experience, because I've gone through that. You've lost access to a part of your body in a way that's really uncomfortable and detrimental, can be detrimental to your health. It's intense, and it can be very overwhelming all the time. So yeah, I relate to the patients a lot.
I'm Rebecca Leach, and I am a patient of Neighborcare. Good service, wonderful staff, and all around just like coming down here. I like Emily. She's fun. She colors her hair all different colors.
everybody embraces the mission of Neighborcare. And so we all kind of have relatable value structure, and it helps us relate and connect to each other. And so it has built a lot of very trusting work relationships. And it's been really beautiful. This is easily the best working environment I've had in my healthcare experience.
I just really appreciate the eagerness of each of my teammates. It's just very clear in all of the people that I work with that we are here for the patients, and we will do what it takes to support them.
What do I love about having the relationships is that I have a chance to get to know everyone individually, and I have a unique and organic relationship with all of them at different levels.
I have a great team. I work with a great, wonderful group. I say our team is amazing.
My doctor is Kelsey, and who cuts my nails is Amanda. Very nice. Nice as in pie.
Nice as pie.
Yeah. Yeah. And every morning I wake up and it's good outside and I see living things and trees and stuff, and I know I'm alive. It's a wonderful world.